Health and Allied Workers Indaba trade union has called on the Gauteng Health Department to take responsibility for its role in the Mathew Lani saga. Now, Lani managed to gain access to public hospitals to film his videos, raising concerns about the risks that patients may be exposed to. In other words, he masqueraded as a doctor. The Gauteng Health Department has since opened a criminal case against him. The health union says the fact that a bogus doctor could slip through the cracks and put patients' lives at risk is disturbing. It also says that the saga has impacted on the reputation of the profession. Let's unpack this further with HAITU's General Secretary, Lerato, Mthunzi, who joins us via our video link today. And Lerato, it's great to have you on the program. Thanks very much indeed for making time. You know, even the health department admits that this incident has exposed the gaping holes in their system. It makes you wonder how many other bogus doctors are out there.
Good morning, Ayanda, and good morning to the newsroom viewers. I think that's basically a story that has been running for a very long time. The Department of Health, in its own admission, knows very well that a few years back we had a doctor that was practicing in CMJA for more than 10 years. We called back then for an overhaul, a system audit. To date, the Department of Health has not taken that charge. I mean, on a daily, healthcare workers, doctors, nurses, pharmacists, people can actually produce fraudulent documents and gain access to treating patients. And I think that's what speaks to the public purse being at the bleeding rate that is at. And I think this is a serious issue, not just about Lani. That's just the tip of an iceberg. The Department of Health must take seriously into account the fact that there are people in the system that are practicing and they're treating patients and they're putting the lives of our people at risk.
Those who are practicing legitimately should be registered with the HPCSA, the Health Professionals Council of South Africa. In our engagement with them, we found that they have a register of those who are doing the right thing, who are practicing legally, but they don't actually have a register of those who've been identified as bogus doctors, which means that people could be repeat offenders.
That's very much correct. I think the HPCSA, together with the South African Nursing Council, abbreviated as SANG, are responsible for making sure that nurses, that is SANG, and the HPCSA with the rest of the health professionals are in their role. And this is an annual thing. So your practice license is something that you renew on an annual basis. However, the honors are still very much on the employer, because the employer is the one that conducts the process of recruitment and selection, and they're the one that employs these doctors. So before any employer, whether private or government, can employ someone, they must verify. They must verify with the regulatory body. They must verify also their qualifications with the institutions of higher learning. This is the recklessness now of the Department of Health, where they will just take papers at face value and not conduct the necessary verification that is ought to happen. And that's how we find these bogus doctors being repeated offenders, moving from private to government, NGOs, and so forth.
Yeah, well, to be fair, Lerato, we're to understand that Mathew Lani wasn't, in fact, an employee of the health department. He apparently was able to gain access to these institutions and just use the infrastructure, if you like, to film his content. But at the very least, I mean, I think the sentiment that you're expressing is one shared by many. This was an individual who was very much in public for quite a long time, not only masquerading as a doctor, but also giving medical advice. In fact, people have come out since to say that he's also dispensed treatment to them, giving them medication. I mean, this could have gone really, really bad.
That's right. I mean, we know it's not an issue of just filming. It's an issue even in the statement of the Department of Health, in their own admission again, that they have put him even on their socials. In June 16, he was paraded by the Department of Health as one of their young, shining, glory doctors. I mean, how can the department be that reckless? Secondly, the department, in their own admission, said he was complaining about non-payment in Helen Joseph when, you know, the officials in that facility had to be put under necessary pressure to look into a matter that it's non-existent. It takes me back. It's not about parading only. It's the fact that there are many, not just on social media, but across the entire broad sector, where people on a daily do masquerade to be things that they are not. But the departments, I think, are very much nonchalant about this whole issue, and they're not treating it with the seriousness it deserves.
What do you reckon they should do in order to convince you that they're taking this seriously? I mean, in our discussions, they've said that they're looking into this. In fact, they've challenged this Mathew Lani to come forward if he still sticks to his guns, that in fact he is a legitimate doctor. If you were to be convinced that the department is taking this seriously, what immediate steps do you reckon they should take?
I think there are three important things. The department must run a overall audit on all its employees. Like I said, it's not just doctors, it's nurses, pharmacists across the board, firstly. Secondly, we know there are people that are put out of adjustment, meaning that I would be a cleaner, but I would put on a position of a nurse. The system in the personal system, particularly in public sector, must actually be audited properly, and we know that the people that are in the system are indeed professionals and they are indeed qualified. Lastly, we need to make sure that the department is able to deal not just with these bogus doctors, but also deal with the issue of ghost posts. There are millions of people across the entire nation where there are people that are supposed to be on the shop floor, and they're not even there. There's people that are getting paid while they don't even step a foot in the hospital. Well, when zooming into the Lani issue, I think the Department of Education has since also released a statement stating very clear that this a person doesn't have a matric certificate, this person went to a special school. It also says we are a department, I'm also adding the Department of Education and Health in the same bowl, that we are not sensitive to those with special needs, and we are not paying attention in making sure there's alternatives for them. We are quick as a nation to just bash one individual and parade them and want to be, the department wants to be as if they're victims. They're not victims in this. They are supposed to be responsible in safeguarding the lives of our people and making sure the practice of nurses, doctors, and all health professionals is safe, and they fail dismally, and their heads must roll. Their heads must roll. People who are responsible for this must actually be held into account.
Yeah, I mean, there are people who believe that the department went a step too far by sharing Mathew Lani's personal information. But to what extent, Lerato, does this also expose some of the systemic issues that have existed in health? I mean, we have reported for years around shortages of staff, as an example, people not being able to have checks and balances within these public health institutions. I mean, these things have created fertile ground, if you like, for the likes of Mathew Lani to, quite frankly, flourish the way they have.
Absolutely. I think you are very much spot on. Imagine being the biggest employer in health. I mean, public sector employs majority of professionals and support staff, and they do not even have a system for clocking in. They don't have a system of clocking in that they revise periodically. I mean, all private healthcare institutions have a bare hands-on or a tax system. They don't even have that. It's all papers and pens. And I can tell you, this system that is not corrected is benefiting people. The fact that we can have people, I mean, the Cuban doctors, the Department of Health is not even coming to the party. They've been paying Cuban doctors even after they had left the country, and people have been suspended for it. They do not have a system, and this system is benefiting them. And there's endemic corruption and looting. It's something that they enjoy so much by creating all this dysfunctional system.
Absolutely. The Mathew Lani saga, a symptom of a much deeper problem in health. Lerato Mthunzi, thanks very much indeed for speaking to us. Really do appreciate it. Lerato is the General Secretary of the Health and Allied Workers Indaba Trade Union. Appreciate your time.